Can you see it?
So good morning, everyone. Thank you for tuning in. This is Rebecca Lee, and she's going to be talking about neuroinflammation. I don't have anything else to add about it because Becca's presentation is very thorough, so I'm going to turn it over to her.
Hi, my name is Rebecca, and I will be talking about neuroinflammation today. The objectives are, following this in-service presentation, the audience will be able to distinguish between acute and chronic inflammation, explain the relationship between chronic inflammation and neurodegenerative diseases, summarize basic underlying mechanisms of the causes of neuroinflammation, describe the effects of neuroinflammation on neurodegenerative diseases, and to develop strategies that can be applied to help prevent neuroinflammation. So, what is neuroinflammation? It is neuro, one part, which is the brain, nerve, or nervous system, often referred to talking about the brain and spinal cord. Inflammation is the body's natural response and defense system against harm. So in neuroinflammation, it is frequently known as chronic inflammation of the central nervous system, which is made up of the brain and spinal cord. That's not to say that neuroinflammation cannot be considered an acute inflammation. It is just more commonly referred to for chronic inflammation. Chronic inflammation in the central nervous system can lead to accelerated brain aging and the increased risk of neurodegenerative diseases like Alzheimer's disease or Parkinson's disease. What is the difference between acute and chronic inflammation then? Acute neuroinflammation is a natural response immediately following damage to the central nervous system. And it helps to drive repair processes, so it's a beneficial reaction that's crucial for the healing process. It helps promote immune conditioning as well as neuroplasticity, which is the brain's ability to alter connections after an injury. On the other hand, chronic neuroinflammation is a sustained activation of glial cells and the recruitment of other cells into the brain. And unfortunately, this can promote damage and also lead to neurodegenerative diseases. And even more unfortunately, chronic inflammation can become relentlessly progressive and harmful. You can see that in numerous neurodegenerative diseases where there really aren't treatments or cures for it that can help, and there's no having it go away. So before I go further into neuroinflammation, I would like to give a background on the neuroimmune responses and inflammation. And the reason why I want to give a background on that is because our body's immune system, I almost consider it for there to be two parts. There is the body's host defense system, and then the body also has a separate defense system just for the brain. And that is something called the blood-brain barrier. The blood-brain barrier is a highly specialized structure. It's made up of various cells like astrocytes, which we will go over, and endothelial cells. And it's important because it prevents pathogens and toxins from harming the brain. And essentially, there is a barrier that's formed between the brain and blood through astrocytes, and that's involved in supporting and maintaining neuronal function. So in someone who has a healthy blood-brain barrier, there is an immunologically privileged site in which peripheral immune cells, so the body's separate host defense system, cannot access the brain and the spinal cord. and that's why it's called an immunologically privileged site. On the other hand, in someone who may have a more chronic inflammation or a compromised blood-brain barrier, peripheral immune cells can bypass that barrier, and that leads to neuroinflammation as a response to try to protect the central nervous system. And the reason why there is that response to try to protect the nervous system is because in a usual scenario where someone is healthy, nothing else, even peripheral immune cells that are part of the host, that are part of ourselves, are not seen in the brain and spinal cord. So it is considered as a technically foreign substance by the brain and spinal cord, which make up the central nervous system. I'm going to talk about glial cells, and the reason is that they are essential for the proper functioning of the central nervous system. It works to support neurons, maintain homeostasis, form myelin, which is the insulation for nerve cells, giving it protection and quickening up its communication with other nerve cells. While on the right-hand side, you'll see that there are a variety of glial cells. Today, I'm going to be focusing on astrocytes and microglia because they are the two glial cell subtypes that are highly implicated in neuroinflammation. So astrocytes, they are a major component of the blood-brain barrier, and they're activated by damaged neurons. And once they're activated, they undergo a morphological change to help repair that damage. And microglia are also glial cells, and they're considered the innate immune cells of the CNS. So why we don't have antibodies like B cells or T cells as a part of the peripheral immune system, microglia are considered the innate immune cells of the central nervous system. Its main job is to constantly survey the environment of the CNS and respond if there's any injury or foreign substances that they don't see or know about. So it's constantly surveilling, and so that allows them to have a very quick response when there is injury or damage. Another important component of microglial function is that it participates in cytokine production and neuroinflammation to protect the CNS. And as stated before, acute neuroinflammation is something that occurs very rapidly after some kind of injury. And in the short term, the acute inflammation can be very beneficial in healing and repairing process of the injury. However, when it turns to a chronic neuroinflammation, the constant activation of microglia cells can compromise the blood-brain barrier. And when there's a compromised blood-brain barrier, there is an increased neuroinflammatory response because there's more recruitment of peripheral immune cells where there really should not be. So I mentioned cytokine when talking about microglia, and what are they? Well, they are a group of proteins that regulate inflammation, whether that be through mediating pro-inflammatory cytokines or through anti-inflammatory cytokines. They also help to regulate cell signaling, cell growth, and cell survival. The picture on the right-hand side is a bit complicated, and that's not necessarily for me to go over with you, but for me to help you understand that the group of cytokines that plays a role in the immune system and helping the host in various ways is immensely complex. And I just wanted to give you an idea of that. Chemokines are a subset of cytokines, and they help regulate cell migration, which means that if there is a site of injury, then chemokines will help cytokines and other immune cells be recruited to that site of injury. Examples of some pro-inflammatory cytokines are the potent interleukin-1 beta and the tumor necrosis factor alpha. Cytokines in inflammation are produced by microglia and the astrocytes, and they also help to, the microglia and astrocytes help to regulate that inflammation. And again, cytokines are essential to creating that inflammatory environment very locally, and it helps to clear the infection and heal the injury. In chronic neuroinflammation, however, there is a sustained release of cytokines. So there's a constant state of pro-inflammatory environment going on. And this leads to the sustained release of chemicals that compromise the blood-brain barrier. And in that compromised state, there is an increased recruitment of peripheral immune cells like macrophages, which we will go over, and T cells. And so in that compromised blood-brain barrier and the increased recruitment of peripheral immune cells, these peripheral immune cells, like macrophages, can more easily cross into the brain, and this further exacerbates neuroinflammation, and this can contribute to neurodegeneration. I realize that what I've said so far may be a bit more complex, and I'm happy to take any questions at this point if there are any. If not, I will be moving on to the causes of neuroinflammation and the underlying mechanisms that are involved. So one of the main causes of neuroinflammation is traumatic brain injury, also short as TBI. And it's caused by a significant force to the head. Now that seems like something major, but it can also be a smaller concussion that can cause a traumatic brain injury. And as a response to that injury, just like any other injury, the body induces an inflammatory response to repair that. And so in doing so, it creates an inflammatory response, recruiting the microglia and astrocytes and the subsequent recruitment of cytokines that we just talked about. So some of the factors that affect inflammation after someone has a TBI are the intensity of the injury. It might be self-explanatory, but the worse or more severe the injury is, the more severe the inflammation will be. Also, there may be other coexisting infections going on, as well as stress. And I do want to talk more about stress, because stress-induced neuroinflammation leads to increased scarring or sclerosis of hippocampus. And it does this by altering the functioning of various brain anatomy, like the hypothalamus, pituitary, and adrenals. And in scarring the hippocampus, it increases the vulnerability of epileptogenesis, which is the increased formation of epilepsy or seizures. And so often people with traumatic brain injury will have a lower seizure threshold. And so you'll see seizures occurring more often, even in people who did not ever have seizures beforehand. Again, astrocytes and microglia, the two main glial cells implicated in neuroinflammation, release pro-inflammatory cytokines like the potent interleukin-1 beta soon after the injury. And that can exacerbate tissue damage, but it can also help to heal. It's the long-term release of cytokines like interleukin-1 beta and TNF, or tumor necrosis factor alpha, that can make tissue damage worse and cause DNA apoptosis, which is death of DNA. And that can damage blood-brain barrier and allowing peripheral immune cells to bypass that barrier and increase inflammation in the CNS. I want to give an example of something that might be pertinent to a lot of people, because football is a sport that many people watch nationally, including in North Carolina. And there have been studies in retired NFL football players who undergo much bodily stress and injury to even their brain and spinal cord due to the impact that they have while playing. And a study has shown that repeated traumatic brain injury led to a higher rate of neurodegenerative mortality and higher incidences of neurodegenerative diseases like Alzheimer's disease or Parkinson's disease. Next, I'll be moving on to spinal cord injury. Spinal cord injury, in response to that injury, there will be a release of pro-inflammatory cytokines. So you'll see that there is very much a repetitive pattern that occurs in all of these injuries, the inflammation, the cytokines that are released. And this injury will activate, again, microglia and astrocytes and recruit peripheral immune cells, and that can more easily cross the blood-brain barrier. I want to talk specifically about a peripheral immune cell called the naive bone marrow-derived macrophages. And when there is a spinal cord injury, cytokines will recruit macrophages to that site of injury. And initially, when that macrophage is recruited, the phenotype or the physical attribute of it is M2. However, in the presence of myelin debris, so that sheath that covers the cell, the nerve cells that helps it with lubrication and better communication between nerve cells, there is debris of that. That will induce the switching, the morphological change of M2 phenotype to M1-like phenotype. So what would be physical attributes or characteristics of M2 phenotype? Well, that's anti-inflammatory cytokines that contribute to healing. M1 phenotype, on the other hand, is a pro-inflammatory cytokine that can cause further damage and release of reactive oxygen species. So in the short term, this switching from the M2 phenotype to the M1 phenotype, that pro-inflammatory acute inflammation environment, can help to heal the injury and repair any damage that may have occurred. On the other hand, however, that long-term increase in the M1 phenotype, the pro-inflammatory cytokines, can lead to even further cell damage and death. And in some cases, it may lead to further damage in which someone may not be able to even walk again or gain full function back. Next, I'll be moving on to air pollution and cigarette smoking. While they, of course, are two separate topics, I did want to group them together because there is a commonality in that we breathe in the particulate matters that occur in air pollution, and cigarette smoking, even if it is secondhand or someone that you're just passing by, doesn't necessarily need to be you that's smoking it. You can still ingest and inhale that cigarette smoke. Talking about air pollution, it is very relevant to us because we are in a city that is growing. But I did mention that the blood-brain barrier is a highly selective environment that's not permeable to many components. However, small particulate matter smaller than 2.5 have been shown to be able to enter the central nervous system through the blood-brain barrier, as well as some other neurons. And this increases the risk of Alzheimer's and Parkinson's disease. And that is thought to be because there's an increased inflammation, neuroinflammation, because these are matters or particulate matters that the brain, the immune system within it does not recognize. Cigarette smoking. In cigarette smoke, there are many toxic constituents that can lead to a pro-inflammatory environment within the body. And it may not necessarily be that the toxic constituents directly enter the brain or cross the blood-brain barrier, but having an overall higher level or baseline level of inflammation in your body can lead to higher levels of inflammation also in your brain, leading to decreased barriers for the blood-brain barrier in a more compromised state, recruitment of peripheral immune cells, and leading to increased inflammation in the brain thereby. And a study has shown that in those who do cigarette smoke, or even are amongst people who do smoke cigarettes, they are at an increased risk of multiple sclerosis, which is a neurodegenerative disease, and we will be talking about it. I'm also going to talk about stroke. So there are two types of stroke, and largely it is either considered hemorrhagic, where you bleed in your brain, or ischemic stroke, where there is some kind of clot that leads to the lack of blood into your brain or throughout your brain. And it's important to discuss this because after an ischemic stroke, neuroinflammation has been observed. And that neuroinflammation causes the death of nerve cells and the upregulation of pro-inflammatory immune cells and further damages the CNS. And so it's important to control that inflammation if someone has experienced an ischemic stroke. Talking about infection and autoimmunity. Infection, various different types of infections and bacterial and viral agents like meningococcal disease can permeate the central nervous system, and the resulting story that occurs in permeating the brain is neuroinflammation. Something that we may not always think about as infection that causes neuroinflammation is SARS-CoV-19, or the coronavirus disease. And many people have experienced post-acute sequelae or some symptoms or causes unknown to them before, like brain fog, where they're just not able to think as well or think as clearly as before, or something might not come to them as well. And all that to say, there's not much that we know about brain fog in coronavirus, but it's something that's occurred in quite a number of people and is being watched by various study groups and the government as well. Moving on to autoimmunity, while there are many other forms of autoimmune diseases, I'm going to be focusing on autoimmune encephalitis. And that is when the body's own immune system, the innate immune cells of the brain, mistakenly attack the healthy brain cells. That leads to neuroinflammation. There's debris from the death of nerve cells, and that further causes damage to the CNS. I'm finally going to be talking about one last cause of neuroinflammation, and that's biological aging, which is a decline in organ and tissue function. And we all know that increasing in age can be a risk factor for many diseases like high blood pressure, but we also know it as an increasing risk factor for cognitive impairment like mild dementia. But it's also an increasing risk factor for developing neurodegenerative diseases. So what's going on is that in aged brains, it's been found that there is a chronically elevated levels of pro-inflammatory cytokines such as interleukin-6. And those elevated levels are similar to the level of cytokines that are seen after a traumatic brain injury as well. So if someone who is a young age has had a traumatic brain injury, then the high levels of pro-inflammatory cytokines, that level will be matched in someone who is of higher biological age. And having that higher level of pro-inflammatory cytokines will indicate a higher propensity or likelihood of developing a cognitive impairment due to the chronic neuroinflammation that is going on. Later on in this discussion, we will be talking about ways in which we can overall decrease the level of inflammation in our body to help decrease the likelihood of neurodegenerative diseases from occurring. I'm going to be talking about the effects of neuroinflammation in certain neurodegenerative diseases next. But before I continue, I'd like to see if there are any questions anyone has or would like any clarification on. If not, I will be moving on to Alzheimer's disease. So current research hypothesis in Alzheimer's disease suggests that the neurodegeneration seen is largely due to neuroinflammation. In the picture below on the left-hand side, you could see that the healthy brain has more substance and sustenance. And as we progress from mild to severe Alzheimer's disease, you will see that the amount of substance or volume within the brain starts to decrease. And that neurodegeneration is thought to be due to inflammation occurring within the brain. Indeed, you will see upregulated interleukin-1 beta, which is a highly potent pro-inflammatory cytokine. In post-mortem brains or brains that have been studied through tissues after someone has passed away, they've seen an abundance of activated microglia. Again, when you have activated microglia, that increases cytokines and chemokines, increasing pro-inflammatory state, that can lead to neuroinflammation and further increased risk of neurodegeneration. So the current hypothesis is that the activated microglia, in addition to the neuroinflammation, cannot engulf, phagocytize the amyloid beta, which is one of two hallmarks of Alzheimer's disease. And that it leads to increased plaque accumulation and further damage to a brain to someone who has Alzheimer's disease. Next, I'll be talking about Parkinson's disease. Parkinson's is a neuroinflammation of the brain, and it's a major component of symptoms and the progression of the disease. And ultimately, that inflammation will lead to brain death. Interestingly, there is the gut-brain axis that is implicated in Parkinson's disease, in which inflammation in the gut is thought to somehow relate to the development of Parkinson's disease. And the evidence for that is that in the early stages of Parkinson's disease, even before it's diagnosed often, patients will complain of constipation. So there may be an inflammatory response in the gut for whatever reason, and there is a changing morphology or shape of a protein called alpha-synuclein. Dysbiosis, or the dysregulation of good bacteria and bad bacteria, causes alpha-synuclein to misfold and aggregate, and that will eventually lead to the entrance into the CNS through what is a leaky gut. And that alpha-synuclein protein in the CNS is thought to contribute to neuroinflammation and further damage in someone who has Parkinson's disease. This is a picture that I will briefly go over. This is in relation to Parkinson's disease. So on the left-hand side, you can see the gut and the brain, and that's the gut-brain axis that they're referring to. And in that picture in the circle, you'll see a good balance of intestinal microbiota. In the middle in picture B, you'll see someone with Parkinson's disease has dysbiosis, or a dysregulation of the balance between good bacteria and bad bacteria. In dysbiosis, there are more bad bacteria than there are good. And that leads to constipation, like I mentioned, decreased gastrointestinal mobility and disturbances. And something that happens in the gut, you wouldn't think would have much connection to something that happens in the brain, but it does. They have connections, and that can lead to increased pain, increased behavioral changes, and even something like depression and anxiety. Picture C just shows that in a potential mix of probiotic supplements that are given, the dysbiosis can be relieved in someone who has Parkinson's, and maybe some of that constipation and pain in the gastrointestinal portion, and some of the pain and depression, anxiety, behavioral changes may be decreased through having a better balance of the good and bad bacteria. Next, I'll be talking about multiple sclerosis. Multiple sclerosis is also a chronic inflammatory disease. It's characterized by the demyelination and neurodegeneration of the central nervous system. So on that picture in the right-hand corner, you'll see that a healthy nerve has a blue sheath around it. And that's the myelin sheath that gives it protection and also helps the nerve cells to communicate quickly amongst each other and even within itself. In multiple sclerosis, that myelin sheath, for various reasons, starts to become destroyed. As it is an inflammatory state, there are pro-inflammatory cytokines that have been found. And the thought is that in a compromised blood-brain barrier due to that chronic pro-inflammatory state, there is the migration of peripheral immune cells into the central nervous system. And these peripheral immune cells within the brain start to produce antibodies against the myelin sheath. Also, T cells, which are part of the peripheral immune system, enter the brain and also are thought to attack the myelin sheaths. Some evidence that suggests that lowering inflammation or having microglia involved in such the pathophysiology of multiple sclerosis is that one of the treatments for MS or multiple sclerosis, it's thought that inhibiting the activation of microglia or inhibiting microglia in general will decrease severity. And the working hypothesis is that decreasing the activation of microglia will decrease the further production and recruitment of cytokines and therefore decrease a pro-inflammatory environment. Also, in very acute symptomatic disease progression of multiple sclerosis, high-dose corticosteroids will be used to lower that high amount of inflammation, and that's used for everyone who presents with the acute and symptomatic multiple sclerosis. Lastly, I'll be talking about amyotrophic lateral sclerosis, more commonly known as ALS. In a normal body, there is something called a neuromuscular junction, and that's simply the connection from a nerve cell to a muscle. And so on the left-hand side, you will see a normal nerve cell, and you'll see that at the tip of the nerve cell, there's a connection in which the muscle contracts. So the message from the nerve cell tells the muscle to contract through the communication at the neuromuscular junction. Unfortunately, in ALS, what occurs is that the nerve has sclerosis or scarring. And ALS itself is a disease that the pathophysiology is really not very well known and not well understood. But what we do know is that the disease is characterized by the activation of microglia and astrocytes, which are the two glial cells we have mentioned over and over again throughout this PowerPoint slide. And so the activation of microglia and astrocytes leads to increased production of pro-inflammatory cytokines, compromised barrier for the blood-brain barrier. And when you have a compromised blood-brain barrier, you can have increased recruitment of peripheral immune cells, and it's bypassing of the blood-brain barrier to the CNS. So T cell infiltration is found in the CNS for those with amyotrophic lateral sclerosis. Next, I'll be talking about the prevention of neuroinflammation. So previously, I've mentioned some of the causes of neuroinflammation, and unfortunately, there are not many medications that will help with neuroinflammation. You do have non-steroidal inflammatory drugs for specific neurodegenerative diseases like multiple sclerosis. You have medications that could decrease inflammation through corticosteroids or decrease microglial activation. But in the end, the prevention of neuroinflammation is prevention itself. So I'm going to go over most of the causes that I talked about and see what could be done about preventing neuroinflammation in the first place. I will be putting some focus on the geriatric population as we are working with seniors. In traumatic brain injury, especially in the elderly, fall prevention is key. So I think it's important to counsel patients or clients especially those who are more elderly and frail, to be cautious when they're transitioning from lying down or sitting down to a standing up position, and when they go up the stairs or down the stairs. Ensure that they always have something to hold on to when they're on the chairs, beds, and furniture and trying to get up. Also, I think it's important to ensure that all these patients not only have access to durable medical equipment like walkers, but also that they understand that they need to use it, that they understand the importance of using it. In terms of spinal cord injury, that is often associated with motor vehicle accidents. So even if it is for a very short distance, just a mile, it's very important to wear a seatbelt while in a vehicle. A large public health measure to increase the number of seatbelts used while driving has significantly decreased the number of deaths while driving. And if you are biking or riding your skateboard, I think it's important to wear a well-fitting helmet. Air pollution is a factor that maybe many people might not think about because particulate matters are not necessarily something that we see. And even when we take a deep breath in, we don't necessarily know that we're breathing in particulate matters. Nonetheless, I think it is important that everyone tries to invest in an air filtration system or an air purifier to remove particulate matters within the environment. There are many air purifiers out there that have allowed air purifiers to be more cost effective. And it will be incredible to see just how much dust and pollen and particulate matters are caught within those carbon filters. In terms of infection control, there are vaccines. The bivalent COVID vaccine has recently come out, but also vaccines that are more catered towards diseases that can affect the brain, like the meningococcal vaccines, and for the elderly, pneumococcal vaccines as well. Proper hygiene is important, and we may not always think about this because the use of masks and social distancing was more of a concept that came up after COVID occurred, but it is nonetheless something that we can use to prevent infection overall, and these are measures that we should always take in place, especially when working with the elderly. Finally, I want to talk about what I consider are the three pillars of how to prevent neuroinflammation. And while the prevention of some causes like biological aging and autoimmunity are unavoidable, it is still up to us, and it is still within our decisions and choices to make healthy lifestyle choices and decisions. And diet, exercise, and sleep have been shown to consistently reduce the impact of aging and reduce the risk of developing an autoimmune disease and neurodegenerative disorders. I want to talk about exercise a bit more, just because there's a lot of data on it, but aerobic exercise combats age-related changes that compromise the blood-brain barrier and that can increase the risk of neurodegeneration. As we age, our blood-brain barrier becomes more permeable. That's just a fact of biological aging. And that is also one of the reasons why biological aging is more highly associated with neuroinflammation and the risk of developing a neurodegenerative disease. And in that vein, it's important to try to get at least 150 minutes of physical activity per week in any shape or form, and that doesn't necessarily need to be aerobic exercise. Talking about diet, I am especially an advocate for anti-inflammatory diets. I did mention earlier on with tobacco smoking that it may not necessarily affect inflammation in the brain. However, cigarette smoking, even if you inhale it as a bypasser, increases the inflammation overall in your body. And so a chronic inflammatory state that's not only caused by tobacco smoking, but even our own diet with high carb foods, high triglyceride foods, unhealthy fats, increases inflammation and increases our risk of neurodegenerative diseases and also other diseases that have inflammation as a big factor, like arthritis and coronary heart disease. And finally, Sleeping for an adequate amount of time, which is usually around 8 hours, and having not only adequate amount of time, but also a high quality of sleep at the same time, is essential for healing the body, decreasing inflammation, clearing debris within our brain, and processing the vast amount of information that we are presented with daily. And just as a note, chronic sleep deprivation is a major risk factor for chronic inflammation and for quicker biological aging. And these are my references, and I am happy to take any questions.
So does anyone present have any questions? I am well aware that Rebecca had pauses during the presentation for anybody to ask, and no one asked anything. But if someone has questions, please feel free to speak up or mention it in chat. Okay, hearing no questions, Becca, I believe you're done. So thank you very much, Rebecca.